Protecting LGBTQ youth, their families, and teachers. Hi, everybody. This is Dr. David, and welcome to another Your Health, Your Choice episode. We are going to be delving into a topic today. It's kind of a part two. We recently did a recording on the ABCs of LGBTQ and put forth a lot of descriptions of what these different terms mean. If you haven't seen it, we would encourage you to please review that to also help with the context of this show as well. I also want to point out that I realize that there are people who will be listening to this who have different points of view. And I do really appreciate that in our last video, although there were people who certainly made comments in our section underneath the video itself, I was really appreciative that they were all very respectful and very on top of not being offensive to other people who may be listening. And it's perfectly fine. I want to see different points of views. I realize that I have a point of view on this. I realize that it's difficult for me to understand some people's points of views, especially if it's not being told to me. So by all means, please share with us what your thoughts are. Now, joining us today is Shari Kulanu, who is both the executive director of our office as well as the producer of this show, as well as my sister. Shari, welcome.
Welcome to me and to you. It's good to be here.
It is good to be here. Okay, so my role here, as it always has been, is as educator primarily, as well as both the facilitator of this particular conversation. Now, my primary role is as somebody who treats children of all ages, genders, of course, but also people of various aspects along the way of the LGBT community and their families. One of my most important jobs is to protect their mental as well as their physical health. And so part of why I want to have this conversation is because with some of the laws that are being passed, at least in my opinion and my view, that might be going backwards for a lot of people. And living in a society that we hope that we move forward, that we understand things. We've certainly seen very much wider acceptance, for instance, of gay marriage in our country, and that's something that's changed relatively quickly over the last 10-15 years. And so when we start delving into the educational aspect as well as the some of the other medical aspects of these things, my hope is to be able to put forth things that will both intrigue you, that will maybe make you think from a different point of view, but also for you to share with me as to where you're coming from and what your thoughts are about this. So, that being said, we are going to be talking a little bit more about the education and, in particular, the Florida Parental Rights in Education Bill, Bill HB 1557, and that there are other states who are now going to be using this as a model for their own states. We're going to be talking about the direct medical impact of some of these laws, including, as many people know, that Texas recently declared that any child undergoing gender affirmation therapies and procedures would be tantamount to child abuse, and that teachers, nurses, doctors, parents themselves could be legally responsible if they were to actually try to pursue or talk about such things. And I do want to also point out, so often people, especially in the trans world, are very much feeling that they are kept in the shadows. They don't feel comfortable coming out of the shadows. Today is where we are recording on March 31st, and this is the World Transgender Visibility Day. And so part of what we're trying to do is to educate and bring acceptance and visibility to this population that has been very much kicked around. And so, again, I realize that this is going to be uncomfortable. It's going to be uncomfortable for me for certain things. But of course, part of the way we get past our discomfort is just having an open dialogue. All right. So, with all of that being said, Shari, tell us a little bit about the basic elements of the Florida bill and other bills like it are.
Sure. Okay. Well, as you mentioned, the Florida law, which was recently signed by Governor DeSantis this past week, so it will go into effect on July 1st for the next school year. It is called the Parental Rights Bill, but actually, when I was reading the legislation itself, I found it interesting that it's under the student welfare section. So that actually brought up some questions that we can talk about later as to whether this is regarding student welfare or parent rights, because those are not always the same thing. But there's two main components to this law and two laws that are being modeled after it. One has to do with restrictions on instruction and instructional guidelines that basically sexual orientation and gender discussion, classroom instructions regarding those things cannot occur at all between kindergarten and grade 3. They're completely banned outright in any form or in any manner. But it also goes on to say that it also prohibits lessons in certain manners that are not age appropriate or developmentally appropriate. However, they do not define what are certain manners. They do not define what is age and developmentally appropriate. So there's a lot of ways that this law is going to go into effect, with a lot of questions that are basically just going to be a social experiment to see how it comes to play. One of the other main areas of this law, so there's the limits on instruction, is there's also limits on the confidentiality between students and school personnel. Generally speaking, it's commonly accepted that students should feel safe to go to their guidance counselors, to their principals, to their teachers, to talk to them about a host of variety of things. And really, unless it's a danger to themselves or others, it's kind of accepted that those are confidential and sacred conversations, that they don't necessarily get to run back to their parents and talk to them about it unless they feel like they're harming themselves or somebody else. And this would kind of do away with it. This would sort of put the onus on the teacher to have to basically tell parents anytime a child comes to them and wants to talk to them about certain topics related to gender or sexual orientation. It's not across the board, but school districts do have the right now to make those conversations no longer confidential, and it won't be left up to the teachers or the educational professionals. So that's that bill.
Yeah. And as a pediatrician who counsels adolescents, one of the things that I do is I make it very clear that I have confidentiality with them. Again, as you said, unless there was a potential of harming themselves or somebody else. And that confidentiality is so important. That's what builds trust. I have had patients of mine who have come out to me not comfortable talking to their parents about it. Maybe we say, hey, do you want me to be part of that conversation for you in order to help break it in? Because I know that your parents have a significant trust in me. That's why they bring you to me in the first place. But to not have that level of sacred trust where you can say something freely, I just feel that just will set these kids back and potentially make it so that they don't want to share what their feelings are. And when you keep things inside, that can have very detrimental effects as well.
Right.
Um, okay, so in terms of the anti-trans laws that are now also being seen in education and healthcare, 33 states now have introduced over 100 bills that are aimed to curb the rights of transgender people. The majority of affected transgender youth already are susceptible to high rates of suicide and depression. We talked about some of that last time overall, but it's even more so. Everything that we're going to be presenting here today, that sounds like it's something that we're presenting as fact. We are going to be putting all of those links into the show notes, so please look below so you can see what's supporting what we're discussing. I'm not going to be sharing screens and all other type of things like I do sometimes, but I do think it's important for you to see where we're getting this information from. Now, there's also this concept of gender dysphoria. This is an actual diagnosis in the DSM-5, which is the manual that psychiatrists put forth for all different types of psychological conditions. And it's a clinically significant distress or impairment related to a strong desire to be of another gender, which may include the desire to change primary or secondary characteristics. So by being impaired, by being distressed, that is what is being seen amongst many of these youth. And of course, is that something that we want our youth to be experiencing? So, Shari, why don't you tell us a little bit more about the gender affirming healthcare bills that have been put forth?
Sure. Okay. So as you and I were talking about, there's really three types of laws that are getting put into play right now that affect transgender people across the country. One of them have to do with gender affirming healthcare. You mentioned this in your introduction, that there are now laws going into effect in various states that if a doctor were to do any type of gender affirming healthcare for somebody under the age of 18, they can be accused of child abuse. They could potentially lose their license. The parents could potentially have their children taken away. The Texas law specifically said, as I said, it does constitute child abuse, and this applies to doctors, nurses, teachers, and stuff like that. They would actually be legally required, if a parent came to them to talk to their child or was considering this, they would be legally required to report that family to the Texas Department of Family Child Protective Services. So that has to do with that. Now, I'm curious, David, as far as these gender affirming healthcare restrictions, what have healthcare professionals and researchers concluded about the impact of these types of restrictions?
Being that there is this very high chance of suicide rates and attempts, we are talking about, for some people, this could be life saving types of procedures that these individuals are feeling is necessary for themselves to make themselves complete, to feel comfortable in their own skin. And if they're not given that opportunity to at least to be able to explore, to talk about it, then that in and of itself, talk about how could this be a life-saving position? Well, you know what? If you can stop somebody from committing suicide, that is life-saving. Um, you know, when we talked about these like gender affirming procedures, I mean, this could be something as simple as a biological woman who or a girl who has breasts who says to me, "Hey, you know what? I'm not comfortable with these breasts here." Now, I don't really know that I'm going to be caught performing surgery, which you can't even do for adolescents, anyways. But even saying something, well, wearing a sports bra may make your chest not be as noticeable, or if you decide to do some kind of wrapping it up, so it kind of it keeps it in. That right there is a gender affirming procedure. By this law, that even could be considered
Right.
illegal and could be considered child abuse. So,
Right.
there are such unintended consequences to vague laws that really puts so many of us in jeopardy that we don't know what the heck is actually okay for us to be able to say and to be in line with these laws.
Right. Well, and I also want to say the American Medical Association has come out against these laws as it relates to gender affirming healthcare specifically. They've urged governors to oppose these state laws. They basically say that it is a dangerous intrusion into the practice of medicine, that this is between doctor and family, doctor and patient. I want to talk about the next type of law. So that had to do with gender affirming healthcare. The next type of anti trans laws that are becoming very popular, including in the state of Florida, are sports participation bans. 37 states have introduced bills that would basically restrict people to participating in sports only to those that have where they're assigned biological sex at birth. This is interestingly, which goes back to some of our gender conversations from last week, quite honestly, in our last episode on the ABCs. Most of these actually are geared at transgender girls, right? And what they're, in other words, people who are assigned male at birth, um, and feel and believe that they are actually in the wrong body. Um, and so, this is basically preventing them from being able to play on girls' teams. And then one of the other things that the American Academy of Pediatrics has come out about and said is that playing sports, especially for youth, is instrumental in developing self-esteem. It correlates to higher overall mental health. It can actually sometimes improve their ability to study and focus and sleep. And it does also, playing sports and training can also be a preventative against suicide. So there are unintended consequences to this. Now, one of the things I want to ask you about, David, you could just kind of talk a little bit about some of these areas, has to do with, there's an argument that's put forth that basically it's not fair to have transgender girls, kids that were born biological male, or assigned biological male at birth. That it's not fair because basically they have heightened levels of testosterone, and it's not fair. It's giving them an unfair advantage on the field. Just tell me a little bit about whether or not that's backed completely by science or not.
Yeah, that's actually it is not completely backed by science. There are studies that have gone two different ways. Now, um, in terms of the testosterone itself, 10% of girls, of adolescent women, girls, women, etc., have polycystic ovarian disease, okay, or PCOS syndrome. They have high testosterone levels relative to other women. Are they an advantage? That should we be checking their levels in order to make sure that they don't have testosterone levels that are too high? I think it's a fair question. A lot of the people, the biological assigned birth at male at birth, um, many of them actually do different types of puberty blockers that lower their testosterone level. Okay. And so, not only do we not necessarily know for sure that there is an advantage, we don't even necessarily know that these participants have higher testosterone levels. They may have virtually no testosterone because their hormones are being blocked in order to allow the secondary characteristics in order to proceed. At Yale University, I'm going to quote this here. They say that the studies of Dr. Karkazis, who is an expert on testosterone and bioethics, says studies of testosterone levels in athletes do not show any clear, consistent relationship between testosterone and athletic performance. Sometimes testosterone is associated with better performance, but other studies show weak or no links. And yet other studies have actually shown testosterone is associated with a worse performance. So here we are making a grand statement that there is this great advantage that they need to protect the girls. Well, you know what? show me the science that actually says that that is a truthful statement, because often, so often, we see that the politics are involved, and that the experts in the field, in medicine, in psychology, bioethics, are not even really taken into account. But whether it's there is some type of agenda that people have, or their own personal feelings, but we're allowed to have our personal feelings.
Right. Well, and I also want to
Are
add
we
some.
allowed to impinge on the rights of others, though?
When I wanted to add something about this because it's something we're going to talk about in a minute in terms of a solution looking for a problem. We are not being inundated by transgender girls trying to join girl sports teams. These are far and few between instances. So to make these really broad laws is really just a way of trying to put, in my opinion, a flag in the ground saying we don't support transgender kids, period. And we're going to do that by saying you can't play sports. I want to say the third type of restriction, which I'm just going to kind of really give a quick analysis of in terms of some of the background behind it, has to do with locker room and bathroom bans, specifically happening in schools for people who do not identify with their sex assigned at birth. They want to be able to use the bathroom that feels comfortable to them. What's interesting is that there's a lot of fear around that these kids are going to go in and there's going to be sexual assault, that they're going to be looking at kids and that it's not going to be safe for the kids that are using this bathroom on the regular. But it's interesting that I will say, so there is a fear that they're going to somehow be inappropriate sexually or make other kids feel uncomfortable in the locker room. The irony and the fact is that transgender teens with bathroom restrictions who are forced to use the bathroom that does not align with their gender identity are at a greater risk of sexual assault. So it's actually the reverse. Okay, so I think that's an important thing to recognize. Is everybody going to feel comfortable with this? No. Is everybody going to feel comfortable with anything? No. Right. So at some point we have to start looking at, are we protecting kids, or are we trying to make everybody as comfortable as possible, or the majority of people as comfortable as possible? And there is a balance there for sure, but this is not a one-sided thing. So I want to look really quick.
Right.
David, I'm going to ask you.
Well,
Oh, go ahead.
also, just no, no, again, please continue, because
Okay,
I know
thanks.
we're short
Yeah,
on time with
yeah,
this,
yeah,
so
yeah.
I want to
So
get, yeah,
I want to jump in. We've been kind of peppering, if you will, or salting, however you want to say it, some of these topics into the discussion that we've had so far. But I want to just sort of take the second part of this show and do a little bit of an analysis of these types of bills. Specifically, I want to start by talking about the Florida Parental Rights HB 1557, which has been coined by people against the bill and also in the media as the "Don't Say Gay" bill. I know that you've expressed frustration specifically around some of the misrepresentation that has been coming out of politicians and supporters of these laws' mouths, the ways that the media is even presenting some of these things. So, you and I have talked about that there has been some fear mongering, there's been some dog whistles. So, there's also some myths, and I kind of want you to talk about what some of the myths are that are sort of being put forth into the public about why these laws have to happen.
yeah, sure. So, politicians, including the governor of the state of Florida, has made specific comments. Again, you will see where these quotes are coming from in the show notes, saying that they're sexualizing of kids in kindergarten. You know, sexualizing to me is talking about sexual activity. Okay. And genderizing is not the same thing as sexualizing. You know what? Open up Sports Illustrated swimsuit edition, open up many magazines, look at many television shows that kids are being exposed to. There is absolute sexualization happening right then and there. Okay. Um, that, referring to, he said, we're seeing libraries that have clear, inappropriate pornographic material for very young kids. I would love to see what he is
Right,
actually referring to. Pornography being in kindergarten, in early elementary school libraries. Whether that, I mean, yes, if that was actually true, and again, if someone can show me what they're talking about, of course that's inappropriate, whether it's heterosexual, homosexual, or any other type of pornography would not be appropriate. Is that really what we're talking about there? Is that really what's happening? Because I defy that, and again, would love to see what is actually being talked about there. Um, Making statements that kids are being encouraged to transition to a different gender. You don't encourage somebody to transition. This is something that a person may or may not have of a feeling inside. You don't just say to somebody, "Hey, you know what? I know you're having a bad day. You know what? Maybe you should consider trying the other sex out. What do you think about that? Just on a lark. Let's give that a try."
right.
It's just, I just don't see how where that's coming from.
Right. Well, I want to jump in there for a really
Yeah,
interesting, just if that's okay. The thing that I find very interesting about this is that the opposite is actually true, right? Professionals are not encouraging kids to transition. Now, they may say, why don't you try to dress in a way that feels comfortable? Or they may say, if there's pronouns that you feel are more comfortable and you want to try using those to see if this is actually a fit, right? Because kids are trying to figure this out. They don't know yet. This is part of what's at stake. But what's interesting is that the professional medical organizations actually recommend against anything related to puberty blockers until the children are much closer to puberty. So K through 3, it ain't even happening for most of these kids to begin with. Not only that, but again, professionally speaking, hormone treatments for feminization or masculinization of the body are typically not considered acceptable in the medical field until almost 16 years of age. Likewise, surgery is almost always considered off of the table until 18. It's one of the reasons why puberty blockers are given, so that the child, if once they've had consults with their pediatrician, with their doctors, with their therapists, with their psychologists, psychiatrists, etc., once they've gone through all of these very intensive kind of processes with themselves and their families, if they're pretty clear that they are going to want to transition at some point, then puberty blockers may be introduced so that they are then given that option as they get older, so that they don't, for example, maybe grow a large Adam's apple if that's not the body that they're wanting to stay in. And then as we said, surgery is pretty much off the table. What about this whole idea of, in the Florida law, about age appropriateness? How would you define age appropriate? Like, are all 3-year-olds at the same level? Are all 8-year-olds at the same level? Are all 12-year-olds at the same level? Where have you found that in terms of being a pediatrician?
Yeah. So, even just in terms of the onset of puberty, okay, we are seeing that this generation of children are actually going through puberty earlier. People can talk about BPAs and some of the plastics. People can talk about soy exposure and non-GMO foods, etc. But they are clearly going through. It's not actually even considered early puberty at before age 8. Okay, so I mean it is early before age 8. So we're talking about a law here that could be affecting kindergarten through third graders. But you know what? There are third graders who are going through puberty already. That may be surprising to older people who didn't, because we were used to, oh, this is a 12-year-old, 13-year-old, 14-year-old thing. That is not what's happening anymore. So to be lumping third graders in with kindergartners in and of itself, especially if they're starting to develop some of these secondary sexual characteristics, that's not really a fair conversation. Yes, there's going to be some kids who will not have that happen for another 5 years. So to put a lump in for an age group or for a particular grade, that is not respecting or understanding where the individual person themselves may be going through.
Right.
Okay. um they're going to be psychologically different people. There's some people who really have no interest in any of this stuff for later on, and it's not that anything should be forced upon them, but for those who are, I mean, let's face it, there are kids in fifth graders who are saying, I have a girlfriend now, or I have a boyfriend now. You know what? It's happening. It's not like you can stop that from happening.
Right. All right. Well, I want to talk, for example, about one of the other things that's getting put forth right now, which is basically that this is not what is supposed to be taught in schools. What's supposed to be taught in schools is reading, writing, arithmetic, some version of history, like all of those various things. But the purpose of school is that, not this. And so, you and I were talking about this yesterday regarding, well, is there any history behind this? Is it such that schools really should be limited to these academic subjects? And so I did a little bit of a quick dive, and I wanted to just share a couple of these things with you before we move on, which is basically kind of the opposite. The National School Boards Association, again, we'll have a link below. They have mission statements. Their mission statement is to help children fulfill their diverse potential, to learn life skills, social skills, to enable them to be well rounded individuals. It focuses on the whole child and not just mastery of academic content. That is in the National School Board Associations for public schools. One of their missions is civic responsibility, to prepare students to live a productive life and become good citizens. Similarly, the U.S. Department of Education's mission statement is to prohibit discrimination and ensure equal access for education, and to prepare children of all backgrounds for global competitiveness by fostering educational excellence and to creating equal access to that. So I just want to push back for a second when people talk about the fact that this is not actually something that teachers should be teaching, that this is something that should be kept to parents at home. That actually goes against what is the mission of public schools. Now, when you and I were talking about this, and you actually had a very simple response to, okay, well, if public schools are supposed to be teaching this, what about the parents who don't want their kids learning this? Do they have any options?
Yeah, so obviously, coming back to our whole philosophy of your health, your choice, choices, okay? And, we advocate for educational choice. Okay. As many people know, I take care of a lot of homeschool families. I take care of a lot of families. So my closest families are people who pursue religious homeschools, who take more of a right leaning type of educational approach. And you know what? I completely support them for that. These are some of my very, very dear people. Okay. But you know what? That's a choice. If you don't want to have your kid in a school that has diversity, that may be bringing these things up, you do have a choice. Don't send your kids to the public schools, because public schools have a particular mission to cover everybody. Okay. So whether you want to choose a religious school, private school, again, homeschooling with co ops and all of those types of things, again, that's such a large percentage of my practice.
Right.
But that is a choice that you have if you don't want your child to be exposed to something.
Right. And just in the interest of time, I want to kind of start to wrap us up here. I know that there's a lot we can talk about this, but, I think that we've kind of gotten some of the main points across. And one of the things that you and I have expressed concern about regarding the Florida bill and other bills that are like it is so vague that it's super unclear actually how this is even going to play out, right? If a kid comes to school and they have two moms and the moms are dropping them off, and one of the other kids who had never experienced that before starts asking, "Oh, do you have two moms?" And then the kid's not sure what to say, or says, "Of course I have two moms." And then the teacher is trying to sort of like step in and give a teachable moment, a lesson about different types of families. Under the Florida law, it's not even clear whether that teacher can be sued by the parents of somebody in that classroom who doesn't want that conversation happening. So this puts like incredible restraints on trained educators, people who this is their profession. They went into this profession because they care about kids, they care about developing these relationships with children. It puts an additional stress on the teachers. It makes it so that school may not be a safe place for the teachers or the students, because the teachers are going to be scared that there's going to be legal action. They don't know what they're allowed to say anymore. I want to sort of jump to the last topic that you and I were talking about, which is if we're talking about trying to protect all kids in school and give them an opportunity to have a good education. I want to talk about the last topic here of the effect that these laws have on LGBTQ youth and their ability to go to school and learn. So, what about the effect that these laws have on those kids? What are some of the stats showing?
Yeah. So within the LGBT youth community, they report higher levels of feeling victimized, of being discriminated against. They tend to have lower GPAs, lower self esteem, higher levels of depression. So when they're being shut down, when they're being made to feel that I can't express myself. I need to watch what I'm saying. A teacher's not allowed to respond to me in the same way. They talk about not being able to discuss gender identity, etc. Well, let's face it. Does that mean that we cannot talk about heterosexual gender roles as
Right.
well?
We shouldn't
Right?
tell boys how
Because
they
if
should be or
not, then
girls
isn't
how
that
they should
discrimination?
be. Right. We shouldn't be able to do
Right,
that.
or
Teachers
to
shouldn't be able
talk
to do that.
or should we not be able to talk about heterosexual marriage? Because you know what? If we're allowing for one but not the other, isn't that discrimination against the child who is to the youth or the family member
Right.
of somebody in the LGBTQ community? That's an unintended consequence. How many of you out there had actually wondered, well, hey, this is saying you can't discuss gender identity, but what about about cisgender
Right.
people who are biologically feeling who are psychologically feeling who they are
Right.
biologically what their chromosomes are saying. So
Right.
this is so vague. Quite frankly, I don't even know if this law will end up going forward in terms of passing constitutional muster. I've seen so much that the vagueness of these laws, the law is supposed to go into place before the start of the next school year in Florida. But yet the regulations aren't actually even supposed to be put forth for a year after that. What are teachers supposed to do if they're not even being told what they can and cannot be able to say?
Right.
Teachers don't make a lot of money. Who's going to pay their legal bills if they say something that may be questionable, or that one particular parent in a classroom says, my kid came home and said so and I'm going to sue you now? You know
Right.
what? Is that the type of thing that we are going to tolerate as a society?
Right. Well, and it's interesting too because there's this whole, again, this goes back to the fear mongering, but the stats just don't play out, right? Again, we'll link to this, but as many as 25%, one in four LGBT adolescents, so, sort of middle school, high school, have either been threatened or physically hurt with a weapon on school property. right? So this is like real stuff. And if we're basically saying to teachers, you can't even talk about this stuff in school, you can't even talk about diversity of human experience and why love thy neighbor is something that you should do, even if it's not something that's comfortable for you or familiar for you, or that you and your family or your religion don't necessarily agree with. If teachers are sort of handcuffed and say, you're not allowed to talk about that, like you are literally putting these youths life's at risk, and their bodies in harm. There's something else I wanted to talk about, which had to do with sex education, because this is like going back to DeSantis. Oh, they're sexualizing kindergartens. Oh, like basically they're trying to talk about gay sex and all this other stuff with like little kids. We know that's not happening. First of all, sex education, what age does that start at? You're a pediatrician. I know you've actually done some of that in the schools. Like, what age do they generally tend to, or what grade, I should say, do they tend to start having like age appropriate sex ed classes?
Yeah, and I can speak with personal
Right.
experience on this for almost more than a half a dozen years. I actually at our local at our kids' school, I actually, as well as Patsy goes and talks to the girls, I talk to the boys. In fifth grade, we talk more about just body parts and what they do, the anatomy, the physiology of it. We don't really get into the discussions of sex. That's not until seventh grade that we have those
Right.
conversations. But still, obviously, a boy who may not have an older sister may not have any idea what a period's about. We want them to know, like,
Right.
hey, do we, you know, understand that there are people who may certain times of the month may all of a sudden be kind of crabby or not feel very good or feel a little bit off. Maybe they take it out on you. Don't take it personally. That may be what they're going through. So those are the kind of conversations that I'm having to the fifth graders, because
Right.
between fifth and sixth grade, there are girls that are having periods.
Yep.
It's
Yep.
happening.
For sure. Well, and the thing is too is that LGBTQ students, they need to know about these things in order to keep themselves safe and in order to make informed decisions for themselves. Um, LGBTQ sex education is actually not included in most sex ed programs, period. It's actually the majority of the school programs in our country are abstinence based, specifically abstinence based. So there's not even a hell of a lot of education other than some straight up biology that's going on there, with a little bit of safe sex education that's introduced in some types of situations. We don't reliably talk about sex education or gender identity in sex ed programs. That's just not. In fact, Florida and many other states outright bans LGBTQ related content in school sex ed programs. So, again, a solution looking for a problem, right? As it is, they've already made this illegal. Now they're coming in and saying, oh, by the way, what we made illegal before, it's still illegal. You're still not allowed to talk about that. um, so I want us to start to wrap up here. As I said, I think there's a lot that we can go about. We've talked about some of the things regarding the Florida bill and the effect that we expect that it's going to have on teachers, and on families in general, right? We also haven't talked a lot about, but you had mentioned this to me, which I think is also very true, about LGBTQ teachers, right? Where do they fit into this? It's like, are they being asked to go back into the closet to be invisible? If their students ask them about, well, what did you do for Christmas? Or are you married? Like, how are they supposed to answer this question? Are they just supposed to say, I can't talk to you about that, go ask your mom? Like, it's just not realistic. And it's not creating an environment that fosters trust and education and love and civility and all of the other things that we would hope are being taught to our kids to be able to live full and productive lives in a multicultural society like we live in the United States. So, is there anything else that you want to add in before we wrap up this episode?
Um, you know, one of the things that I always try to do is to put myself into somebody else's shoes. Try to flip that around, and how would that person handle it? And so I guess I would ask this question, especially to people who maybe even find this show offensive. Um, you know, if your child came home and was explaining to you, "This is who I am. I actually tried to do something because I've been so shut down with this. You know what? I'm considering that maybe it's not worth being here." What would you do if that was your child? Okay, would you throw them out? Would you tell them it doesn't exist? Would you try to make some kind of conversion therapy to them? Or would you take a realization of, oh my God, this is my child here. This is somebody, I mean, I have quite a few patients who are in the religious mode, who lean towards the right, who then their child comes out to them. or comes out to me and wants me to help them talk to their parents about that. I will tell you that the families that I've worked with and these parents who may have never thought about this before, it changes them. They thank me. I've received messages thanking me for the video that we did last time, because it was even just on the definitions, because it helped them understand their children better. It helped them realize that the words that they say can have a really strong negative impact on their own children, their nieces, their nephews, their friends. Okay? So every now and then, try to put yourself in somebody else's shoes. See if that changes around your mind at all. See if that changes around your sympathy. See if you realize, hey, am I thinking about this the right way? You may come to the conclusion that you're not. And you know what? That is part of the freedom of choice as well. But hopefully, by you hearing that what we're talking about today, maybe it'll spark something for you to realize that, hey, I never saw it that way. Let me think more about that as to how I want to evolve, because you know what? We're all trying to evolve as human beings. If you've been following this channel all along, and if you've been patients of mine, we're always talking about trying to, how do we move the ball forward as society, whether it's how we're trying to keep ourselves body healthy. We're talking about exercise and eating organic and doing the types of things and avoiding food labels that, that we can't read all the labels and know what those words actually mean. You know what? Those were things that the generation before us did not do, right? We have evolved. And so this is also part of that, is realizing that society as a whole, there's an evolution there. And how can we have the grace upon other people in order to try to make everybody as happy and fulfilled as possible?
Right. And I just want to say something, and this goes to a personal thing. And you and I talked a little bit about my own personal experience on the ABCs of LGBTQ, which I encourage everybody to check out. You know, I've been pretty forthright about the fact that I've dealt with some depression and those kind of things throughout my life. And I look back and I think to myself, if some of these conversations were happening in school when I was growing up, and I would have felt like there was a place to talk about it, or like that I felt like people were helping me understand some of the things that I was feeling a little bit better, um, it could have made a huge difference in my life. I came through okay. I was surrounded by loving parents and a loving brother, and I had a lot of opportunities, a lot of privilege in my life, and so I'm one of the lucky ones, right? That came through on the other end of it, and I'm okay. But, I really do think that one of the things that's happening right now is that sometimes laws are passed by grown-ups because they don't like what the kids are doing. They don't like what the generation that's coming up under them is pushing, right? We saw this with segregation. We've seen this with different things. Overwhelmingly, people under the age of 25, people under the age of 18 are so much more willing to be open about gender expression, gender identity, sexual orientation, all of these types of things. And I personally think that it is scaring the hell out of a lot of their parents' age and older. And they're trying to sort of stop it. Well, guess what? It's not going to stop. It's just a question of how much harm is going to be done in the attempt to try to stop the movement and, like you said, the evolution of humanity and the human experience. So with that in mind, thanks for having me on the show again.
Absolutely. And of course, always our call out, if you're not subscribed to this channel, please do so. Please hit the notification button so you know when we put something else forward. Please join us on our Patreon account, where I continue to put exclusive content. Hope everybody has a great day and you've had something to think about.